Good afternoon, and I'm so glad that you asked that question about exactly what he means by these sensational feelings. So I'm going to explain this in a way that if you have any questions, just let me know. But the syndrome itself is called Brown-Séquard syndrome, and it is a rare spinal disorder that is a result from an injury on one side of the spinal cord. The spinal cord is damaged, but it is not severed completely. So, and when he's talking about when he has paralysis or weakness on the same side of the damaged area on his spine, that is called ipsilateral hemiplegia. So that's on the exact same side of that area. So, and then on the opposite side, he said that he's feeling a loss of pain and temperature sensations. That's contralateral. That's on the opposite side. So he will only be able to know that he was touched, not exactly where he was touched. So he will not be able to feel many light sensations or fine touch, but he will be able to feel the more the deeper pressures and stuff like that. He also might have a loss of proprioception. He might be able to tell you more about that, about how he feels in space. Like you feel, you have to feel oriented in space, and he might not feel that way. And all of these things are caused by the crossing of these fibers. Now, that's in the spinothalamic tract, and that carries the information about pain and temperature. So when I was talking about the pain and then the temperature, how on the opposite side, how he's not feeling that on that opposite side, that's because of these fibers. Now, this is across the body, so these fibers cross onto that side. So that's just a good way to understand why he's feeling that way on the opposite side, because you wouldn't think if you damage the right part of your spinal cord that your left side of your body would suffer. But it's good to be able to understand a little bit about the anatomy and physiology of that. So I'm glad that I could help you a little bit to understand that a little. But and the best way, because I know you want to help him to recover in the best way possible. So to recover from this, for the most part, it's just in the first stages to just immobilize the back completely with a back brace, or just simply just staying in the bed. And I know that you want to take as good of care of him as you can, but if you need help, if you need home health aid to come in and help, feel free to ask me any questions about that. I'll be glad to give you some options and some resources for that. But for the most part, just immobilize the back. And if you have any questions, you have my number. Please give me a call. And do you have any more questions? Just let me know.